This is Matt Dean. The Minnesota Legislature is on our Easter Passover break until April 7th. When we come back, we're going to have the challenge of putting together our budget. Part of that budget is Health and Human Services, and that's what I'm going to be focusing my time on. One of the things that we're looking at is really reforming the way that we provide state-based services to folks. One of the most controversial pieces of that is MNsure. MNsure has been a disaster from its rollout to today. And really, looking forward in the budget after the legislative auditor's report and after many constituents and people all across the state of Minnesota have weighed in on this, we've come to the determination, at least I have personally, that MNsure should be abandoned, and we should try to get the dollars that would have gone into MNsure into helping Minnesotans. Minnesotans who think they have insurance but maybe don't, or maybe Minnesotans who want to try to get on health care insurance. We've been hearing from those folks from every single county in the state for years. And one of those folks came in last week. His name was Charlie Dunker. He and his wife Gail signed up for MNsure. They tried to go on the online application process. Gail worked and called in and got all the help she could, and finally she got to the end and it said, "Congratulations, you've completed your application." She then got paperwork in the mail. She mailed it in. She did everything right. They thought, great, we've got our MNsure, and they didn't think about it again. Not until she started feeling a little bit sick a couple months later, and she went into the doctor. The doctor prescribed some tests and also found out that she in fact did not have health care insurance. The health carrier didn't know who she was, quite frankly. And she went into a familiar cycle to many Minnesotans of the providers, MNsure, and the counties all pointing fingers at one another to figure out what's going on. Minnesotans are trapped in the middle of that cycle, all over in every county in the state of Minnesota. Gail Dunker had to put off going to the doctor to get diagnosed. Unfortunately, she was diagnosed with cancer. That cancer was spreading very quickly, and by the time she collapsed and was admitted to an ER for the care that she needed, it had spread too far and she passed away in January. Now, her husband Charlie and their son Sam came to the Minnesota Legislature so that another family across the state doesn't have to go through the same thing that they did. It really moved a lot of people and changed some minds about where we need to go in the future on MNsure. We need to really get some help to the people who need it most, the people who've had the rug pulled out from underneath them over the past couple of years, who were promised they could keep their doctor if they wanted to, they could keep their plan if they wanted to, only to find out that they had to switch plans and get thrown onto a broken website and told to call a number, to have a person at the other end maybe pick up after hours of the phone ringing, just to find out that they can't solve their problem. So what we need to do is we really need to redeploy those dollars and hours towards helping people like Charlie Dunker and his wife Gail and their son Sam, and families all like the Dunkers all across the state of Minnesota. That's what I'm going to be working on, and I'm really going to be focused hard and focused very narrowly on the patients and on the people who are receiving services. That's one thing that we really heard loud and clear, is that we really need to focus on the people receiving these services and less on the bureaucracies and on the paperwork and all of the finger pointing that goes on in government and these big bureaucracies. Because when it comes right down to it, it's about people, it's about Minnesotans like Charlie and Gail Dunker. So that's what we're going to be focused on when we come back. We are looking forward to working with the Senate and with Governor Dayton and his staff to try to do the best we can and to do right by Minnesotans. And I think that's where we should come to for a common ground agreement in the area of healthcare, and in fact in all of our areas of the budget when we come back. So with that, I want to just wish all of you, and particularly the staff at the Minnesota Legislature, who does such a great job helping all of us, a very happy Easter Passover break. Thank you very much, and we'll see you after April 7th when we return from our break.